Are weighted vests good for bones and muscles? Fact checking a fitness trend. Now let's take this and let's look at it. And hit the follow button because I'm Dr. Wendy. I'm a physical therapist. I take care of women, and I want you to know women's health is always underserved. So if you have seen your girlfriend wearing a weighted vest, there is a reason. She might be postmenopausal, perimenopausal, or she might be a little bit heavier and wants to drop some of that visceral fat off her body. Now, let's look at this. Our current thought, because there's an art and a science, is that these weighted vests are going to help maintain bone and muscle strength as you age. There is a natural decline in strength and bone as we age because if you are a person with a vagina, you will experience ovarian insufficiency, and as your estrogen declines, the way your muscles and bone remodel is so you have to up your game, okay? So wearing a weighted vest is loading your spine, an axial load. So your vibration plate that you may or may not do, which I love, is going to work for the lower half of your body. The weighted vest, the theory would be it would help your spine because we are loading your spine. Now, it's also going to help postural muscles, and because you're wearing something heavy, it is going to up your heart rate. Now, here we go. In this article, it is a really big deal because menopause is having a moment, and so you're going to see all these people wearing these things, and the claim is it does have a host of benefits. Now, if you've ever worn a weighted vest, you realize it is harder to do whatever you're doing with a weighted vest because more is being asked of your muscles and your heart. So you're a little sweatier, you're a little breathier, your heart's pumping a little harder because that's real. And so NPR, doing what NPR does, is checking the evidence and saying, hey, there just aren't that many studies with weighted vests, and the ones that do exist do not bear the claims made on social media, especially around bone density and muscle strength. One small study compared walking with weighted vests with those who didn't, and they found no significant difference in bone health because I believe the study design was bad and it was too short. The study design is a real problem with weighted vests, but doing research is hard because getting people to be compliant is very, very difficult. Another small study did find some benefits of people who were wearing weighted vests while engaging in resistance workouts, but the study doesn't make clear whether the vests or the exercises were the cause of healthy bone growth. And they go on to say, without rigorous testing, it seems like it's a novelty item. Okay, there's not going to be rigorous testing and there's not going to be research anytime soon on women, especially postmenopausal. And so we can ask to wait for the research, but if we did that, we would never have anything. So there's an art and a science. But if you've ever worn a weighted vest, they freaking exhaust you. And so weighted vests may have some benefits for cardiovascular health. And it will increase your energy expenditure, your oxygen consumption, and all those vascular responses will go up. So it goes up proportionally with how much weight you add. There are some cardiovascular benefits to adding weight to your workout. So especially if the weighted vests make the difference between someone exercising and someone not exercising at all. Okay, I want to show you this. Now, this is an older study. And now listen, we normally throw old studies out, but sometimes landmark studies are oldies and goodies. This one is from 1998. Weighted vest exercise improves indices of fall risk in older women. And when they say older women, they mean 50 to 75. Okay, so these women are probably postmenopausal. Oh wait, yes they are, 5 years past menopause. And there's 44 community dwelling women, and they had them wear this for 9 months, and they did not find that it helped with bone density. But there was improvements with stability, so balance, lower body muscular strength, muscular power, and lean leg mass. And so the bone density didn't get better, but their balance and their ability to move and their strength improved, which then means they're less likely to fall, which means they are more likely to exercise and have a better chance of having healthy bones. So I want you to know women's health is never top-notch priority. And so we have to sometimes go with the working theory that if I load something heavy, change will happen. The research isn't there yet, and nor shall it be. We could look at this study. We could look at this study. We could look at this study. What we do know is it seems to help muscle strength, cardiovascular improvement, and if you improve your muscle strength, your muscles are an endocrine organ, which means it's going to fight insulin resistance. We know that this alone is a big deal in the postmenopausal community. If I can keep you walking and I can keep you stronger, I'm going to help your bone density in the end. But no, There is not a delightfully perfect study, randomized controlled, with enough power to apply to the masses for perimenopausal, menopausal, postmenopausal women wearing a weighted vest. But have you looked at the research for women for exercise in this group? It's minimal.